How to recognize an Ascaris infection. Ascariasis is a type of infection caused by a roundworm called Ascaris lumbricoides. These parasitic worms eventually settle and grow in the small intestine. They can grow to 12 inches or more in length and drain the body of nutrients. 1. Ascariasis is common worldwide, especially in children who live in tropical and subtropical regions and where there are poor sanitation practices, but it's fairly rare in the United States. Most infected people show mild or no obvious symptoms, so detecting ascariasis is often difficult. However, recognizing the signs and getting appropriate treatment can help prevent a variety of health problems. Recognizing ascariasis. Take notice of respiratory symptoms. Although most people infected with Ascaris lumbricoides worms don't have noticeable symptoms, those with weaker immune systems often do. Sometimes the first signs of ascariasis are similar to mild to moderate cases of asthma or pneumonia, such as persistent cough, shortness of breath, wheezing and mild chest pain. You may cough up mucus, sputum, and see blood. After ingesting fertilized Ascaris eggs, they hatch in the small intestine and the larvae get absorbed into the blood and travel to the lungs, causing irritation and a type of allergic response. After spending about a week in the lungs, the larvae eventually get coughed up the trachea and into the throat, where they are swallowed down the esophagus into the stomach and pass into the small intestine. Be aware of abdominal pain and nausea. The Ascaris larvae leave the lungs and end up in the small intestine, where they mature into adult worms over the course of a few weeks and live there until they die, many months or a few years. The worms can block the intestine or bile duct, and this causes abdominal pain. The abdominal discomfort is difficult to pinpoint and can easily be mistaken for indigestion and bloating, but it's not relieved by passing gas or taking antacids. In mild cases, the nausea comes and goes, but does not usually lead to vomiting. Children who live in poor sanitary conditions and have weakened immune systems are much more likely to get infected and develop symptoms. Watch for bloody diarrhea. If the body's immune system can't fight the worm infection, then more of them grow and increase the likelihood of uncomfortable symptoms, such as severe abdominal pain and diarrhea. If the blood is dark and looks like coffee grounds, then it signifies bleeding from the small intestine. If the blood is bright cherry red, it signifies bleeding from the rectum from too much wiping or a burst blood vessel from straining too hard. In addition to blood in the stool, sometimes a visible Ascaris worms can be seen in the toilet. Look for chronic vomiting and weight loss. In moderate to severe cases of ascariasis, the worms can nearly completely block the small intestine, which leads to severe abdominal pain and nausea, and triggers bouts of vomiting. Even if food is available, it's often not eaten due to loss of appetite and painful digestion. Weight loss is most noticeable around the face, upper body and buttocks, thighs. The abdomen can still protrude due to the mass of worms and blockage of food and liquids. Worms can often be seen in the vomit of people with severe Ascaris infections. Take note of signs of malnutrition. As the symptoms of ascariasis progress, particularly in children, signs of malnutrition become more obvious and include severe weight loss, stunted growth, short for age, weakness, fatigue, skin rashes, visual problems, and intellectual, developmental disability. The most common nutritional deficiencies related to ascariasis are protein, vitamin A and vitamin C. A lack of protein causes muscle wasting and weakness, as well as a distended belly. Lack of vitamin A leads to visual problems and potential blindness, as well as skin issues. 7. Lack of vitamin C leads to skin issues, internal bleeding, hair and teeth loss, as well as fatigue and listlessness. Distinguish it from other infections. Ascariasis can mimic a great number of other types of infections and diseases. When the Ascaris larvae cause symptoms in the lungs, it can be similar to asthma and upper respiratory viral infections, such as influenza, the common cold and pneumonia. There's also some symptomatic overlap with gluten sensitivity, irritable bowel syndrome and Crohn's disease. It's only when actual worms are found in vomit or diarrhea that ascariasis is more obvious to doctors and patients, and easily distinguished from other infections or diseases.